If you have atrial fibrillation, and if you're over 75, if you're a female, if you have diabetes, especially, or if you've had a stroke before, TIA, you must take a blood thinner because the risk of stroke is very high. So yes, atrial fibrillation, you need to. Now, having said that, you need to define what atrial fibrillation is. Is it constant atrial fibrillation or intermittent atrial fibrillation? That's number one. Number two, you got to look for the cause of your atrial fibrillation. If you treat the cause, you may not actually have so much atrial fibrillation or very little or even cure it. For example, if you have a valvular disease, uncontrolled hypertension, obstructive sleep apnea, or if you have any underlying issue. And last thing is metabolic syndrome. I've got lots of patients who don't have valve disease, high blood pressure, nothing, but they have metabolic syndrome. And when I treat the metabolic syndrome, the atrial fibrillation goes away. There's an epidemic of atrial fibrillation going on because of metabolic causes of atrial fibrillation. So your answer is complicated. If you're in it, and you know that there's no way you're coming out of it, then you should take a blood thinner to prevent a stroke. On the other hand, if you can find an underlying cause and reverse that so you don't get the problem in the first place or cure yourself of atrial fibrillation, then that's the supreme way to go.